Hello, everybody. My name is Charbel Massad, and
Hello, everybody. My name is Charbel Massad,
and I'm co-chairing this meeting with Pamela.
I'm co-chairing this meeting.
We have a problem with sound.
Problem with sound.
Les amis, moi, je ne vous vois plus. Je vous écoute, je vous entends, mais je ne vous vois plus.
Il y a un
Est-ce
petit
que tu peux
problème.
m'envoyer, s'il te plaît, le YouTube?
Je ferme tout de suite. C'est bon.
Voilà.
Okay, I'm sorry for that. We had a problem with the sound. So I'm Charbel Massad, and I will be co-chairing this meeting with Pamela Huys. Donc, Pamela?
Yes, so good evening, everyone. I am Dr. Pamela Hues. I have an MD in internal medicine and a master's in molecular and cellular biotherapy. Currently, I'm doing a PhD at Institut Crochet on type 1 diabetes, and I will be the co-chair with Dr. Charbel Massad.
So I'm Charbel Massad. I'm professor in neuroscience at the Université de Paris, and I'm also the dean of the Faculty of Basic and Biomedical Sciences at Université de Paris. So today our meeting will be on pedophilia, which is a very serious social problem. And we will speak about social and medical aspects of pedophilia and its consequences on the victims. So I will share with you some slide about the history of pedophilia. Pedophilia is a problem, is a social issue that is about 3,000 or 4,000 years old. In the Greek era, pedophilia was a common practice in daily life, and some ancient Greeks regarded it as a common practice and sometimes something to be celebrated. In ancient Greek and also in ancient India eras, pedophilia was considered as a blessing from gods. And in the myth of Greece, you will find, for example, pedestry, like the history between Zeus and Ganymede. Ganymede was a young boy, a shepherd, that was granted immortality by Zeus after sexual acts. And you will find also pedophilia as a blessing in the Indian religion. So, you know, Arsha marriage in India is a marriage between a young girl and a god. And you have this also in India now, the marriages between young boys or girls and adults. In the Roman era, pedophilia was a little bit different. Roman was uncomfortable with the pedophilia. So it was not as open to the practice of pedestry like Greek. The Roman would pursue sexual relationships with younger men, but these relationships were only seen as forgivable if the older man was a freeborn Roman and the partner was a younger slave or a prostitute who wasn't from Roman origin. In the Arab area, everybody knows the gallant poetry, the Ghulam poetry. And there are several poems in the Arab literature in the Abbasid era about the sexual behaviors with young men, with boys. In Europe, in the 70s and the 80s, we had the golden age of the defense of pedophilia in France. And you have on the right a letter written by 69 French intellectuals. This letter was published in Le Monde and also in Libération in the 26th of January, 1977. It was signed by Jean-Paul Sartre, Simone de Beauvoir, Jacques Lang, Bernard Kouchner, who were both of them French ministers. Louis Aragon, André Glucksmann, philosophers. All these people signed a letter published in Libération and Le Monde to defend 3 men imprisoned for more than 3 years for having sexual abused minors. under 15 years old. And also you will find books written by, for example, Daniel Cohn-Bendit, which is a German neurodeputy. He wrote books on pedophilia, and I have translated a paragraph of this book. So on the right, you have the French, how to say, the French part of the book, and on the left, the translation. And he wrote, "It had happened to me several times that some kids would open my zipper and start tickling me. I reacted differently depending on the circumstances, but if they insisted, I caressed them anyway. I needed to be accepted unconditionally by them, wanted the kids to desire me, and I did everything to make them depend on me." So this was written by a German neurodeputy. But in the 21st century, pedophilia is now a crime. And you will see in this slide some well-known pedophiles like Epstein, Dutroux, Fourniret. They passed away in the jail, or they are still in the jail. Dutroux maybe will go out from the jail in a few months. So in the 21st century, pedophilia is a crime, and it's also an illness. And during the talks today, our three speakers will speak about the aspects of pedophilia. In literature, it will be Jumana Timuri who will speak about that. The pedophilia as an illness, and also she tries to find the cure for that. It will be the talk of Florence Thibault. And finally, Eleni Zavara will speak about pedophilia and the effect of child abuse on the modification of brain structures. So thank you very much for all three of you to have accepted our invitation. And I'll give the floor to Pamela for the second part. Thank you.
Thank you, Charbel. So I have the pleasure to introduce our first speaker, Dr. Jumana Shahal Timuri. Dr. Timuri is a research professor in literature. She has a PhD in lyrical Occitan poetry from La Sorbonne, Paris 5. She is interested in the medieval literature and the link between Occitan and Arabo-Andalusian poetry, and has many publications on this topic. She is the co-founder of l'École supérieure internationale de Paris. Moreover, she is the founder and the president of the Association Patrimoine Tripoli Liban that focuses on saving Tripoli's heritage. Today, Dr. Timuri will be talking about pedophilia as described in the Arabic literature. Dr. Timuri, thank you for being with us. We are looking forward to your presentation. Just a reminder, if you have any questions, feel free to write it on YouTube, and we will be later asking it to Dr. Timuri so she can answer. Thank you, Dr. Timuri. You may start.
Thank you. Thank you. Thank you so much, Pamela. Just I have only a small different thing, because I will talk as well on many kind of literature, not only Arabic literature. I'll talk a little bit on something else, but majorly on Arabic literature. That's true. So good evening, and it's a pleasure for me and an honor to meet you and to be a part of this group of renowned experts to talk to you about the sensitive issue of pedophilia from a literary criticism point of view. First of all, I would like to apologize for my English accent, for I have been teaching literature in France for several years, and I haven't had the chance to practice English much. I also know that English literature in Anglo-Saxon countries differs greatly from that of the language of Molière. So I would like to take this opportunity to thank Dr. Charbel Masad, Dean in René Descartes University, for this kind invitation and for giving me the opportunity to participate in this interesting roundtable. Today, it is very essential to raise awareness and fight against pedophilia, an issue that is very important, that is very controversial, and that raises the question of ethics and the legitimacy of these relations. During my talk, we will go through extracts of text and poems about how pedophilia was portrayed in literature, and that in today's world, it is not a separate subject or a non-spoken of subject as it is often written about in the media. The image painted out by ancient Greece, poets of the Arab world, and other ancestral societies, like Dr. Charbel said, shows in their text clear examples of glorification and justification of pedophilia, if I may say so. We will see that this matter is recurrent, not only in a few texts in a specific period of time, but it is present in many sorts of texts like poetry, novels, stories, etc. We will talk today about the notion of pedophilia, noting that what I will speak about is not exhaustive. First written about in the oldest civilizations, being the Greek civilization, as Dr. Charbel said, it is also present in the anti-Islam Arab poetry era, known as Al-Jahiliyyah, in the 8th century as well, with Abu Nawas and other poets. In the Abbasids and Umayyads eras, it is also mentioned differently in various children's books, as well in French modern literature, as he said also, and the recent era of sexual liberalism. In the past, pedophilia was not always considered with a negative connotation or approached with utmost seriousness. However, in recent years, a light has been shed on the matter, and most importantly, on the importance of dealing and fighting against pedophilia, especially after the rise of the Me Too movement. Despite recent developments in fighting pedophilia, we have seen little, if any, on intellectual denouncing through their writings against pedophilia or against their peers who have written and encouraged it, especially after May 68 and the sexual liberation movement. Then we will start with the ancient Greece. In ancient Greece society, the relationship, as he said, between an adult male and adolescent boy who was theoretically between the age of 15 and 18 was very popular. This pederasty relationship finds its essence in an aristocratic ideology based on warlike companionship. With the emergence of the literature and cultural period of classicism, pederasty was less promoted, if I may say, but was still largely followed, especially in big Greek cities, which retained in majority this aristocratic conception of educating virile love. In the context of rivalry, which was characteristic of ancient society, the love affair was an elder was supposed to demonstrate bravery, courage, excellence, etc. It was a misogynistic ideal of total virility, as stated by, for example, Henri-Irénée Marot in 1984, who was writing the Histoire de l'éducation dans l'Antiquité, Le Monde grec. What is ironic is that although pederasty was allowed and exposed in broad daylight, the law formally prohibited sexual relations and the rape of young people. In Athens, the law sanctioned prostitution, pimping, and the rape of children and teenagers. Famous people like Platon, who were often called to testify in favor of pedophilia, tried to purify their educational practices by moralizing pederasty relations. Therefore, it was easy to realize that pedophilia was also part of the culture. The sexual maturity of young people did not limit only to biology. It was eminently cultural datum. Athenian girls were often married between the age of 12 and 14 to men who were almost 30. They were mothers by the age of 15, which was considered extremely normal and was written in a literature as a normal story. That's why a former Hollander MP who had worked on lowering the age of sexual legal age in his country bluntly justified that his law amendment proposal by referencing ancient Greek literature, education, and practices. The example of ancient Greek culture, literacy, and history is underlying. Now, moving from the ancient Greece, we will now talk about pedophilia in Arabic literature. For the purpose of our discussion today, I have decided to explain pedophilia in Arabic literature using authors from different periods of time. In first part, we will see how Arab poets portrayed homosexuality and pedophilia, same. Then we will discuss the famous poet Abu Nawas and his writings. Looking at what is available from Arab literature heritage, we notice that unlike Occidental literature that was highly influenced by the clergy and Christian morality, Arabic poetry was very avant-gardist in that matter. And there was no religious influence. Joseph Pitts, a young Englishman captured by barbaric Algerian pirates, recounted in his book, which is a true and faithful account in 1790, he wrote, quote, the horrible sin of sodomy is far from being punished amongst them to boast and brag of their detestable actions of their kind. It was common for men to fall in love with boys as it would have been to fall in love with girls in England, unquote. However, later in history, there is a clear passage of stages of purification that was developed through time for political purposes and moral claims that are dominated in patriarchal sense. This is clearly shown in the Quran in Surat al-Qamar, verses 33 to 42, when God said, God unleashed a cloud of stones against the Lot people. The Lot people is the homosexual and pedophilian. This is from Quran. The other verses is verse 33, when he says, the people of Lut believed the warnings. Verses 34, verily, we sent against them a violent storm of stones, which destroyed them all, except the family of Lut, whom we saved in last hour of the night. Nobody knows why. Despite this purification and burning of texts related to gender and pedophilia issues, the Arab literature heritage is full of flexible, even liberal texts. Dealing with all kinds of issues of sex, including homosexuality and pedophilia that were practiced by ancestors and praised by poets who also indulged in its practice, shown in the following examples. First example is Waliba bin al-Habab, known as the Sheikh Shara al-Majinin, which means Sheikh of the pervert poets. Waliba bin al-Habab, from what is narrated, was a teacher of Abu Nawas and a Baal to him. Abu Nawas was a boy submissive to him. And when Abu Nawas grew up, he started asking for the boys and became the aggressor himself. Despite that all, his texts were about perversity. We still find individuals such as the Khalifa Mahdi who have defended him in a complex way when he says, إلا أنه كان أديب واسع الحفظ ما أشعره وما أملح شعره, which translates to, he is an eloquent scholar who knows his verses by heart. His poetry is at the top, and what a daring poetry it is. So in generally, pedestry, pedophilia, and homosexuality practices were common in medieval Islamic times, and many poets and a number of governors indulged in homosexuality and relationship with minors and Galmanism. The best example to cite here would be that of Nizhat al-Albab, where it's narrated that, quote, a friend of Waliba, Abu Samah, asked permission to have a physical relationship with Waliba's student, Abu Nawas. Abu Samah, said, I am very telling to Abu Nawas, his friend Waliba, I am very attracted to your ghulam, Waliba. Aren't you ashamed to say that? He is my ghulam. Waliba then repeats his encounter with Abu Samah to Abu Nawas, who is in turn replies, I am at your service. I will obey as you are my Baal, unquote. So what is the Baal? The Baal is the equivalent of of suzerainty, which was reenacted and practiced in the Middle Ages as well by the troubadour. The troubadour, who are the poets of the Languedoc, who were influenced by the Arabo-Andalusian poets and who took up word for word the poetry commonly called the poetry of the Muwashahat. In the Muwashahat, a word that recurs regularly is the name of Futuwa, the word of Futuwa, which comes from the word Fata. And the Fata is the young boy who belongs in some way to his master, who obeys him and who is under his mercy. The word Futuwa finds its equivalent also in the Occitan of the 11th and 12th century in the regions of Languedoc, namely the word joven, which means youth and of mind and body, youth and of mind and body. Like, for example, in the writings of Pierre Vidal and Marcabrou, amongst other troubadours, we realize that even in the Middle Ages, when it was under the rule of church and conception of purification, there were still references to pedophilia in literature. This is to say that interaction existing between different civilizations show the importance of the role of literature. And this is why I'm happy to talk to you about this. So another example, if I can, Safi el-Din al-Halli, among the poets who loved boys and praised their love, the Safi al-Din al-Halli, named after the city of Hilla in Iraq, is among the famous poets of his era. Al-Halli wrote a poem in which he described his involvement in physical relations with young men. In his poem, Al-Hamdiyat, he says, فتن الأنام بعوده وبشدوه شاد تجمعت المحاسن فيه. I will stop here because I cannot tell everything because it's very dangerous, which translates in English to everyone adored his body and way of singing, a singer who gathered in him all beauty. Third example, Ibn al-Haqqi of Kalila and Dimna. You know, Kalila and Dimna is the most famous book in stories for children, like the conte. He was one of the most prominent Arab poets, and he translated from Persian to Arabic Kalila and Dimna. Al-Haqqi was also, in addition to being a poet, was what we today we refer to a pedophile, because his relationships with young children. In his writing, he talks about his love for a young Turkish boy called Yetek, that his neighbor bought for 1,000 dinar. He portrays his adoration for young boys in his writings when he says ليتني والجاهل المغرور من غر بليت نلت ممن لا أسمي وهو جاري بيت بيت قبلة تنعش ميتا إنني حي كميت, which translates to I am the ignorant and arrogant who is in love with a boy. I wish I'm with him and he is my neighbor. A kiss from him revive a dead, and I am now alive but like a dead. Hamad al-Rawiya, another one, we call the narrator. The Arabs also knew him for his extensive knowledge and of foreign heritage and its transmission. He was also known for his pedophile tendencies through other authors, poems and songs such as Abi Yaqub al-Khazimi, where he describes an encounter with Abu al-Qasim Hamad that involved physical encounters, which translate, I'm not going to tell it in Arabic. I was in a gathering with Hamad and Hamad the narrator, and with us a young man. Hamad the narrator looked at him deeply and said to me, I decided that tonight I will bed with the Ghulam. These are just few examples amongst many. However, today I have decided to concentrate on Abu Nawas. Abu Nawas' poetry lays between pedophilia and individual freedoms. He talks a lot about alcohol as well. Abu Nawas reached through his poetry the peak of boldness when he still wrote, regardless of the sociological and civilizational environment in which he lived, and composed poems where he revealed his love for flirting with young boys. Abu Nawas' poetry was not only an immoral flirtation, but also a sensual and a physical one. It includes physical characteristics of young boys, their submissiveness, gestures, and way of speech, and effeminate behaviors. I will translate some of them. No completed pleasure but with a boy, drinking and without a bird, one redeeming him and other greeting him when serving him coffee, and whenever he wants a kiss, he gives his mouth. So it's in this poem, Abu Nawas explains his love and physical attraction for young boys and the pleasure arisen by his pedestrian envies. However, it's important to note that this propagation of lyrical pederasty in Arab literature only became popular when and written after the second half of the 2nd century after Hijrah. Before that, Arabic literature did not witness a tendency towards boys in politically palatable form. Some critics in a justifiable reading of history have tended to say that Abu Nawas' tendency towards boys, poetically and sexually, is an echo of a general phenomenon that appeared strong in the Abbasid era, as Dr. Charbel said. Exposing his society with all its covert hypocrisy and exposing it as a player of obscene poetry. Indeed, people like Ahmad al-Saqaf insist on the innocence of Abu Nawas, explaining that while it is true that there is a lot of mention of homosexuality and pedophilia in this poetry, but this is only to show his intellectual superiority in poetry. Others, like Ahmad Kamal Zaki and so on, analyzed that Abu Nawas' style of poetry was under the Al-Amin era. In other words, he defends Abu Nawas, saying that his poetry was a form of protection, allowing him to please the governor and be able to live in peace. Let's move now to French literature, May 68, liberalism. The matter of pedophilia was not always negatively connoted in modern days as well. In fact, following the events of May 68, French intellectuals were quite relaxed and liberal on that matter. During the 70s, a number of politicians even tried to relax laws regarding pedophilia and tried to pass a law allowing adults to marry and or to have sexual relationships with underage girls. It went further than with intellectuals. When, as Dr. Charbel gave the names of these people, okay, I will finish. Okay, admitted, but also promoted and encouraged physical and emotional relationships with underage girls. Gabriel Matzneff, everyone knows who's Gabriel Matzneff. He's a part of this presupposition of May 68, sexual liberation. The type of novel is, however, an exception to this observation. The novel with a pedophile tendency. This perspective, we will briefly study an account by Gabriel Matzneff, Isaïe, Rejoice, published in 1974. I will go quickly on this. The plot exposes the marital crisis that Nil Kolichnev and his wife Veronique are going through. Both belong to the second generation of Russian immigration into Paris. They became lovers while Veronique was still a high school student and Nil already a recognized writer. A few years later, they get married according to the Orthodox rite. Before the marriage, Nil collected female conquest while multiplying adventures with children and adolescents of both sexes. After the celebration of the marriage, the union, Veronique, he imposed a discipline. But since his marriage, obviously, I will miss the thing in the books, but I will tell you something. Matzneff novel seeks to extend the pedophilia to permissive norm established by the event of May 68 in matters of sexuality. It feeds and even inaugurates a current of protest for sexual liberties and refraining from setting a legal age. After that, we have Tony Duvert, Gabriel Matzneff, Guy Gong, etc. I think that Dr. Charbel talked about these people. The intellectual and the media gladly opened their platforms and wrote columns to promote their writings. And some of them had, Tony Duvert won the Medici Prize in 1973. Finally, I want just to say that sexual versatility is assimilated to a rejection of bourgeois values, such as possessiveness, while pedophilia is instituted and an act of rebellion. He said, quote, me too, I stick my tongue out of the serious people to bourgeois society, unquote. Libertinism, the mysticism of the flesh laws, lose their distinctive virtue as soon as everyone is led to have extra experience and dissociate himself from the average French. I will finish my topo in saying that, in other words, is the taboo the result of social consensus, subjective to change from one era to the next? I would like to tell you just a few words about Lebanon, because sadly, Lebanon, the population is very concerned about the defense of rights of children. We still do not have a law condemns the forced marriage of minors, despite the presence of several NGOs who are active and make campaigning to prevent the forced marriage of minors by refraining from implementing new laws to defend their minors. Lebanon is in clear violation of the Universal Declaration of Children's Rights, of which he is a signatory. So what I want to say is, in Lebanon, we don't even see the cases. We do not report the abuses. The number of rapes actually perpetrated on children is out of proportion to that of official registered case. It's not our discussion tonight, but neither in public nor in private, victims are parents hide in appalling silence, educational establishment, social welfare, institution, and police services practice the same omerta. As for the media, yet always ready to stir up conflicts in region from morning to night, they barely skim the subject. Intellectuals are and experts have a role to play in raising awareness, which my peers will discuss with us today and tell us about the psychological and pathological prejudice suffered by the victims. It is absolutely essential that there be more openness and that the observations show that what was being done in the anti-Islamic period and the Middle Ages is no longer daring to do it now or to speak it even if it continues to exist. Thank you for listening to me, and if anyone has any question, please go ahead. Thank you.
Thank you, Jumana, for this excellent talk. It was impressive. Thank you very much. So just a quick question, because we don't have time.
Yes.
Je t'avais promis de poser les questions en français, donc je vais le faire. On a une inversion donc de la perception de la pédophilie entre le monde occidental et le monde oriental. Le monde oriental était était plutôt ouvert à la pédophilie, alors que le monde occidental était sous le joug des catholiques, et donc c'était quelque chose de banni et d'immonde, et ce qui est tout à fait normal. Et ensuite, on a eu une inversion, alors que le monde musulman est devenu plus religieux, le monde occidental est devenu plus libéré. Donc, deux questions. Est-ce que tu penses que la pédophilie est liée, la considération de la pédophilie comme étant un crime est liée au vieillissement de la population? Et est-ce que tu sais s'il y a des différences de la perception de la pédophilie entre les différentes religions, comme par exemple le catholicisme, le protestantisme?
Alors, en fait, pour ta première question, je ne pense pas que ce soit quelque chose qui soit en relation avec le vieillissement de la population, mais c'est surtout qu'il y a eu une vague après mai 68 de libéralisme sexuel et qu'il fallait surtout, il était interdit d'interdire justement, et beaucoup de slogans que je voulais d'ailleurs vous projeter, mais après j'ai changé d'avis, beaucoup de slogans qu'il fallait justement apprendre à nos enfants à faire l'amour, à la sexualité, etc. Donc, il y a eu cette vague-là qui a au final été, on a vu les résultats de cette campagne, etc., de cette vie un peu hippie, un peu anarchique, etc., et les conséquences qui ont éclaté avec les scandales qui ont éclaté dans les milieux ecclésiastiques. Donc ça, c'est la première chose, et c'est ça qui a fait que ce phénomène est en train de régresser. Enfin, en tout cas, on l'espère, mais c'est là aussi le rôle des médias et le rôle des écrivains et le rôle de la littérature et le rôle de tous ces intellectuels qui doivent en permanence mettre en garde contre ça et aider les spécialistes, les experts que nous allons écouter juste après, qui vont nous expliquer à quel point c'est dangereux. Alors, pour la deuxième question, qui est donc de savoir si s'il y a une différence entre le catholicisme et le protestantisme, je pense que toutes les religions, dans aucune religion, on acceptera, et j'ai donné les exemples tirés du Coran, dans lesquels l'islam aussi considérer que les Louts, c'est-à-dire le peuple de Louts, c'est-à-dire les pédophiles particulièrement, sont haïs et détestés. Mais malgré tout, je pense que c'est plus sociétal que religieux. Aucune religion au monde ne va accepter ou ne donner la liberté aux gens de se faire du mal ou de faire les choses à l'envers. La vie est, voilà, on n'entrera pas dans ce débat, je pense, mais si c'est pour la religion, il n'y a aucune religion. Il y a une influence à une certaine période. On sait que le Moyen-Âge était très ancré dans le catholicisme. On sait que l'islam était beaucoup plus libre du temps des Abbassides et des Omeyyades qu'actuellement, et les sociétés vont avec. Les transformations sociétales sont en fonction des transformations et puis des gouverneurs et puis de tout ce qui se passe. Et déjà, le début du XXe siècle était beaucoup plus modéré dans toutes les religions qu'actuellement.
Merci beaucoup, Joumana. Vraiment un topo excellent, très informatif.
Merci beaucoup.
On va passer donc maintenant à Florence.
So we will move on to our next speaker, Professor Florence Thibault. Professor Thibault holds an MD degree in endocrinology and in psychiatry and addictions, and a PhD in neurosciences. She is an attending physician at Cochin University Hospital since 2013 and a member of the Psychiatry and Neurosciences Department at INSERM Université de Paris. She is the honorary president of the World Federation of Societies of Biological Psychiatry, and she focuses on candidate genes in schizophrenia and the addictive disorders and the treatment of paraphilic disorders. She has 240 publications in her field and is the author or co-author of around 70 books chapters. She has been working on treating paraphilic disorders for the past 35 years and contributed to the first guidelines on the management of these disorders. We are glad to have her with us today so she can share her experience on clinical aspects and treatment of pedophilia. Professor Thibault, the floor is yours.
Thank you very much, Pamela, for your nice introduction. I will try to share my screen. Can you see it? Yeah. So thank you, Professor Massad, for your kind invitation, and thanks a lot, Pamela, for your nice introduction. First of all, I have no disclosure for this talk. And we talk about treatment of pedophilic and paraphilic disorders. And just before, I will briefly introduce the notion of pedophilic disorders for those of you who are not familiar with this concept. So some facts about sexual violence worldwide. 30% of women have been victims of physical or sexual violence at least once in their lifetime, which is quite a huge number. Victims were mainly women, 80%, and mainly under the age of 30 at the time of victimization. The incidence of sexual violence was increased by 5 times during the COVID pandemic. And finally, 72% of sexual trafficking is related to girls and or women. And of course, this was greatly increased during the recent crisis, which is still ongoing. What about sex offenders? I will mainly talk about rapists for adults or children victims, or some exhibitionists. Perpetrators of sexual offenses were mostly males under the age of 25 years in half of cases. 1/3 of them are below 30 years of age, and 20% are below 15 years of age, which means that more and more adolescents are now sex offenders. And this is especially the case in the US, and this number is growing in Europe. 90 to 90% of them were males, which means that in rare cases, females could be sex offenders. 2 to 3% of them only, which is a good thing, are serial murderers, which means that very few are serial murderers. But the most intriguing thing is that less than 3% have been sentenced. And you have also to pay attention to the fact that about 10%, only 10% of all victims will take an action against their perpetrators, which means a very low number of victims. We talk about that. Definition and clinical characteristics of paraphilic and pedophilic subjects. First of all, I will talk about paraphilia. Paraphilia means deviant sexual behaviors, but for political reasons, we are not anymore allowed to talk about deviant sexual behavior, but about paraphilic behaviors or disorders. Paraphilia or paraphilic disorders are sexual disorders characterized by recurrent, intense, sexually arousing fantasies, urges, or behaviors involving sexual activity, but this is unusual sexual activity which may involve non-human objects, such as clothes, for example, and the suffering or humiliation of oneself or one's partner, which means sexual sadomasochism, or a pubescent child or children, generally age 13 years or younger, which is the worldwide definition of prepubescent child or children. And the perpetrator, according to the definitions, the current definitions of paraphilia, must be at least 16 years old and at least 5 years older than the victim or the victims. But things are changing as more and more adolescents are now perpetrators. And these sexual disorders may also involve other non-consenting persons, such as animals, for example. And these sexual disorders may occur over a period of at least 6 months and cause clinically significant distress or impairment in social or occupational functioning. And this is particularly important, and we'll come back to that a little bit later. So the paraphilic disorder might be exclusive, which means there is only that type of sexual disorder which might be used for the perpetrator or for the individual to have sexual relationships, or maybe non-exclusive. For example, the patient can be pedophilic in certain circumstances and be married and have children in other circumstances in the rest of his or her life. So that means whether the person can be sexually aroused only by children or also by older persons. Most of them if I talk about pedophilic subjects, most of them have a female preference, but 9 to 40% of them have a male or sometimes exclusive male preference. And we make the distinction between the victim preference because this is related to the risk of recidivism. And those only interested in males are at higher risk of recidivism. Some of them might be only interested in their own children. This is called incest, and this concerns about 20% of pedophilic sex offenders, and they are supposed to have a lower risk of recidivism. And some of them, about 1/3, are only interested in child pornography, but we don't know exactly the risk of acting out of those only interested in child pornography. We may think that about half of them will at one time in their life act on real kids, but that's not very clear until now. So there are, in addition to pedophilia, there are specific types of paraphilia, such as exhibitionism, sexual sadism, voyeurism, frotteurism, fetishism, or sexual masochism. In the European classification, sexual masochism is considered as something which might be normal in brackets, and they added the term coercive sexual masochism, which might be relative to a higher risk of rape. In addition to these 7 specific disorders of paraphilic disorders, they added a residual category called paraphilia not otherwise specified, which might be, for example, zoophilia or many others. There are like more than 100 different types of paraphilia or deviant sexual behaviors. So this is according to the American classification of paraphilic disorder, the prevalence data they gathered in the general population. As you can see, and that was from German and Belgian recent studies, when they anonymously interview people in the general population, almost half of them reporting having paraphilic fantasies in their everyday life. Some of them were acting these paraphilic fantasies in their everyday life, and others did not. And most of these paraphilic fantasies were voyeuristic, exhibitionistic, froteuristic, or sadomasochistic fantasies. And they were more frequent in males, but they were also observed in some females. But the pedophilic fantasies were only observed in 3 to 5%. And when I say pedophilic fantasies, I mean that 3 to 5% of men anonymously answered that they had sexual relationships with children without telling that to anyone and without any complaints. In females, that was much lesser, but we have no figures about that. So paraphilic disorders, excluding pedophilic disorders, are very frequent among the general population, but pedophilic disorder, which means acting on children, is observed in 3 to 5% of the population, which is quite a high number of people who are at high risk of pedophilic disorder, which means having a relationship with children. I don't talk about pedophilic fantasies, which are much more frequent in the general population, as high as 15% of the general population may have pedophilic fantasies without any sexual relationships with children. So the recent classification made a difference being pedophilic and having pedophilia, which means having only atypical sexual interests and fantasies without acting on these sexual urges. If you can think of children and sexual relationship with children, that means pedophilia. If you acted on these sexual urges, or if these sexual urges cause marked distress or interpersonality, we now call that pedophilic disorder. But not all patients with pedophilic disorders are sex offenders or known sex offenders. In many cases, they only suffer from pedophilic sexual fantasies or urges, and their pedophilic sexual behavior does not involve non-consensual or otherwise illegal acts, including watching child pornography. In another way of talking about that, if we consider sex offenders, most sex offenders do not suffer, including, of course, sex offenders, do not suffer from a pedophilic or a paraphilic disorders. So in general, pedophilic disorders will act on their fantasies in 50% of cases, and sex offenders are true pedophilic patients in 50% of cases. In other cases, pedophilia is linked to surrogates, which mean replacement partner, because they're afraid of, they are homosexual, for example, and they're afraid of having adult partners, so they may try with children when they are young, and then they will discover that they are homosexual, and they will have adult partners. Or that may be also because they are very antisocial, or because they like novelty. So they will try children as sexual partners, and then they will move to adult partners. In general, 12 to 20% of prisoners around the world are sex offenders, which means that they are not the majority of people present in prisons. But that may also be because, of course, there are very few complaints against sex offenders. What about psychiatric comorbidities? If we talk about pedophilic disorders, and most of sex offenders who are studied are sex offenders with pedophilic disorders. So they show a high evidence of comorbid pedophilic personality disorders or psychiatric disorders. 30 to 50% of them have comorbid personality or psychiatric disorders, all kinds of them, of course, affective or anxiety disorders, hyperactivity, substance use disorders, which may increase the risk of acting out, hypersexuality, which is also a risk factor. Schizophrenia or other psychotic disorders are very rare in case of pedophilia. Dementia, primarily temporal and or frontotemporal dementia, might be involved. So if somebody becomes pedophilic at the age of 60, usually it's because he's starting dementia. Other cognitive disorders after brain trauma, severe brain trauma, or when they have mental retardation might also be associated to pedophilic disorders. The main problem with pedophilic is when they have their first acting out or when they will recidivate. And the mean reconviction rate for all sex offense is about 14%. It's lower for incest and much higher for male pedophiles, which is from 20 to even 40% the risk of recidivism in these pedophilic patients only interested in male victims. And it may increase to 22% after 5 years in untreated offenders. And we make a distinction between dynamic risk factors and static risk factors. And this distinction is interesting for psychiatrists and psychologists because, of course, dynamic risk factors means that they may be addressed and psychotherapeutic treatments may help to improve these factors. What are these dynamic risk factors? They are about personality disorders such as psychopathy and antisocial behavior, which might be improved. Denial, which is very frequent but might be improved. Low self-esteem, which may increase the risk of recidivism. Addictive disorders, mostly alcoholism or drug abuse, such as especially cocaine abuse, which may be a risk factor. And also psychiatric comorbid disorders, which need to be treated. And there are also static risk factors that you may take into consideration, but you may not change them, such as early age of onset of pedophilia, intellectual disabilities or sequels of head injury, past history of sexual abuse or physical violence during childhood, which is observed in 30 to 40% of child abusers. Previous sexual offenses, the highest number of previous sexual offenses, the higher risk of recidivism. Previous non-sexual offenses, especially those associated with violence. A great number of paraphilic interests reported by the offender, but the strongest predictor of recidivism is, of course, the interest in children and pedophilia, as measured by plethysmography, especially when victims are unknown or sometimes declared by the patients themselves. What about treatment in these patients? The aims of the treatment of pedophilic disorders are three. First, to control pedophilic fantasies, urges, and behavior in order to decrease the risk of a sex offense and to protect the general population. Second, to decrease the level of distress of persons with pedophilic disorders, which means that you pay attention to the perpetrator himself and to his suffering. And third, to enhance, if you can, but that's not very easy, non-pedophilic sexual interests and behavior, or at least to help him to improve the control he has on these pedophilic fantasies. The treatment choice will primarily depend on the patient's previous medical and psychiatric history, his or her compliance, the intensity of pedophilic sexual fantasies, and the risk of sexual violence. And when the risk of sexual violence is high, usually we use hormonal treatment. Treatment of comorbidities, especially personality disorders or psychiatric comorbidities, is necessary and may help very much to decrease the level of recidivism. Psychotherapy, especially CBT, which is the only form of psychotherapy which has shown some level of evidence of efficacy in sex offenders, is always used in all cases. And sometimes you may associate pharmacotherapy with antidepressant or hormonal therapy. Prior to treatment, you have to carefully examine by at least one mental health professional, especially a psychiatrist, in order to identify and evaluate the patients. You have to identify the number of type of paraphilic disorders, because very often pedophilic disorders are associated to masochism or sadism or exhibitionism that might also have to be taken into consideration during treatment. The motivation for treatment, the compliance, and previous response to treatment, if any previous treatment. If necessary, protect and adequately treat offenders, especially those who are suffering from major mental illness or mental retardation. And some of them are sent to prison without any treatment. And sometimes only treating them and improving their major mental illness may be sufficient to prevent recidivism. Abuse past history is also a very important factor. Being neglected or sexually abused as a child are significant factors mainly associated with pedophilic disorders and the risk for sexual abuse. That concerns 30 to 40% of child sex offenders in general, and almost 40% in our cohort of 300 sex offenders. Psychological treatment of physical or sexual trauma is now considered as a major component of the treatment plan. In the past, that was not taken into consideration, but now we have like 2 treatment plans. The first one is to take into account and to treat their history, past history of sexual abuse or physical abuse, and second, the treatment of their paraphilic or pedophilic disorder. So if you evaluate a sexual offender, you may describe the paraphilic disorder, one or several paraphilic disorder, psychiatric comorbidity, personality disorders, which need specific pharmacological treatment or specific psychotherapy in addition to the treatment of paraphilic disorder. The evaluation of pedophilic disorder. You may take into consideration the age and the gender of the pedophilic patient, which means that treatment might be different, especially if they are females. Marital status and contact with children, which needs specific medical social measures. Education level is not the same if you consider those with mental retardation and those with a high education level. Type, number, if there are several paraphilic disorders, for example, associated to pedophilic disorders, the age and gender of victims, which is very important in terms of risk of recidivism. Is pedophilic disorder exclusive or not? Is it intrafamilial or not, which means incest or other pedophilic disorders, which means that those with incest are lower risk of recidivism. The age of onset, psychiatric comorbidity, denial, motivation for treatment, violence, impulsivity, which means higher risk of recidivism, pornography use, hypersexuality, which may increase the risk of recidivism, mental retardation or brain injury, past history of sexual abuse, somatic comorbidity, which might be a problem for treatment, past history of sentence. The more past history of sentence, the higher risk of recidivism, and previous treatment for paraphilic disorders. And then you, at this stage, you may evaluate the risk of recidivism, and actuarial scales might be useful to help you to evaluate the risk of recidivism in these pedophilic disorders, which may be very important to consider which treatment you will use in these pedophilic disorder patients. Treatment option. if you talk about pedophilia, you have these pedophilic patients with very low risk of sexual violence, such as those with incest. In these cases, you will use psychotherapy, especially CBT, plus treatment of past sexual abuse. And in some cases, you may use, in addition, specific serotonin uptake inhibitors off-label and at high doses like those used in OCD treatment. In those with moderate or high risk of sexual violence and any risk of acting on children, you may use GnRH agonist intramuscular formulation, which means that you have no problem with compliance, once, 3 or 6 months, which means every month, every 3 months, or every 6 months. You will use CPA, cyproterone acetate, for the first week in order to prevent the flare-up effect at initiation. And this is now the preferential treatment for pedophilic disorders with any risk of sexual violence. As in the past, we were used to use cyproterone acetate, but now due to the risk of meningioma, the European and the French drug agency will not recommend the use of cyproterone acetate anymore in sex offenders, unless you have a high contraindication to the use of GnRH agonist. In case of treatment resistant, you may combine SSRIs, antidepressant, and even cyproterone acetate in the most difficult cases. And Charbel was referring to Marc Dutroux, for example, who is probably somebody very difficult in terms of treatment. And in this case, you may probably have to combine several treatments. Treatment duration, you may not abruptly stop GnRH agonist treatment because there is a risk of rebound of testosterone level and a risk of recidivism. In case of severe side effects with GnRH agonists, which is mainly osteoporosis in addition to, of course, the reduction of sexual behavior, which is differently appreciated by pedophilic patients. But in case of severe osteoporosis, you may use calcium or vitamin D or biphosphonates, like treatment in menopaused women. And after treatment with Doror, hormonal treatment can even be resumed in case of recurrence of paraphilic or pedophilic sexual fantasies or behavior if you continue to follow up these patients, which is not always, but in some cases, the case with these patients. These are some references. We have written to my knowledge, only references about treatment of paraphilic disorders in adults in 2020 or in adolescents, which is mainly based on CBT in adolescents with paraphilic disorders. And these are two books plus one book chapter I've recently written on the treatment or the clinical aspect of deviant sexual behaviors. And this book combines the clinical aspects in victims as well as some testimony of perpetrators, where they explain why they had pedophilic behaviors. And this is there is an Arabic version of this WPA International Competency-Based Curriculum on Interpersonal Violence and Sexual Violence Against Women. That was written some years ago, and we have made the French translation. And if you tap this email address, you will find the Arabic version of this curriculum, which might be useful to train some health or caregivers or health nurses or personnel involved in the treatment or victims of sexual violence. These are my books. And I cannot resist to invite you to our next World Congress on Women's Mental Health. I'm the current president of the International Association of Women's Mental Health. And this Congress, which will be held in Maastricht, the Netherlands, in November 2022. And we hope at least hybrid, because we hope that the pandemic will be behind us. So thank you very much for your attention. Open to questions.
Thank you, Professor Thibault, for this talk. It was really interesting. So I have a question for you. So are there any genetic predisposition to pedophilia?
Maybe. There are several studies trying to find candidate genes, but which were not successful during the last years. And there were two, I think there were two, at least Finnish, but I don't remember the other one. I think there were two from Finland, studies showing that if you have one brother or one father with pedophilic disorders, you have a higher risk of being pedophilic yourself, independently of a past history of sexual abuse. So that means that there is something related to genetics, but until now we have no genes, and probably low heritability, which is estimated to be around, I think, 20 to 30%, which is quite low until now as compared to, for example, autism, where the heritability is estimated around 80%. So there is something, there is a weak signal which needs to be further studied.
Okay. And I have a question from YouTube. Can a child feel a desire to have sex with adult? What would you consider it? It's the opposite of pedophilia.
It's not very clear. You mean, what do you mean? If adult and having fantasies on adults is the opposite of pedophilia? Or is that what you mean?
Yeah.
I don't know. I think having fantasies on children is something which is not, I would say, the usual sexual behavior. And in addition to that, the damages on victims are so high. If you consider that 30% of our population of patients has a past history of sexual abuse. So that means that there is a high risk for victims of pedophilic perpetrators. But I don't know if we can oppose adult and child fantasies. I think this is different. The regular sexual behavior is about having sexual behaviors between adults and consenting persons. So child fantasies about children would be something atypical, called deviant in the past. And that's what I can say.
Okay, there are also a question. There is also a question from Dr. Timuri. Are patients with pedophilic disorders conscious that they are doing something bad? Do they feel ashamed? Do they feel any guilt?
It's a difficult question, because when you see these patients at first glance, they are so deeply involved in sexual behavior with children that they can't think about the damages. It's I think it's like a sort of addiction. So they wake up in the morning, and they, especially when they are exclusive pedophilic patients, and they think of finding a child and having sexual relationships with this child or these children. So when you use treatment to try to reduce this this sort of addictive desire, then they start thinking of the damages they will cause to the victim, and they say, well, I just realized because I received this treatment that I am a pedophile and that something is wrong in my behavior. That's very usual. And the second thing is that some of them do not realize or do not want to realize that this is something wrong until they are sent to jail. And then suddenly, when they arrive in the prison, they realize that it's something forbidden and they don't want to go back to jail. And they said, no, this is forbidden. And I know that and know now that this is forbidden because I went to jail because of my behavior. So treatment and jail may be helpful to prevent from recidivism.
Okay, thank you. We have also a question from Dr. Masad, if you want to ask it directly.
Okay, thank you, Pamela. Thank you very much, Florence. It was really excellent. I have two questions. The first one, there's no gene that is, or genes linked to pedophilia, but did somebody do NMR? Did they look at the metabolomics part of pedophilia? Did they identify any signature in the metabolism of pedophiles? My second question, do you know if pedophiles have high amount of testosterone or DHT? And does flutamide could be a treatment for them to decrease the amount of DHT in their blood instead of decreasing the amount of GnRH?
Concerning your first question, the answer is no. To my knowledge, there were only association studies in the old way and no further studies, but maybe there are ongoing studies that I don't know. But if you consider only published studies, there is nothing about metabolome or more sophisticated techniques in genetics. Concerning your second question, there were a lot of studies between testosterone, sexual behavior, and violence. And there are some literature showing that in the most violent patients, testosterone levels are normal, but in the upper range. But nothing about pedophilia. There is some, I think there is an old paper showing that there is an increased level of LH without any abnormality in terms of testosterone or DHT levels. And concerning your third question about flutamide, flutamide was used in combination with, I think it was a GnRH agonist in one patient. That was one of the first studies. And combining flutamide plus GnRH agonist was not more efficient than using GnRH agonist alone.
Okay, thank you.
Could you unmute yourself, please? You are muted. Thank you.
So thank you, Professor Thibault. We're going to move to our last speaker, Dr. Eleni Zavara. So Dr. Zavara holds an MD degree in psychiatry and a PhD degree in neurosciences. She is currently a research director at INSERM. She is specialized in psychiatric diseases and has a background in research and development in the pharmaceutical industry. She is also a member of the International Consortium of Clinical and Preclinical research with over 83 publications and around 5,907 citations. Her main interests are the pathophysiology of psychiatric diseases, brain neurotransmitters, and psychotropics. Her work focuses on the changes induced by the early exposure to stress at the level of transcriptomes and the link to psychiatric diseases development. Dr. Zavara will be talking about the consequences of childhood adversity at molecular and cellular levels. Dr. Zavara, thank you for being with us today. You may start your presentation.
Thank you very much, Dr. Ahuez, for this introduction. Give me a second. Okay, I'm very honored and glad to be here and be part of this excellent discussion and symposium. Thank you very much, Charbel, for the invitation. So I am going to talk from the effects of pedophilia on the victims, especially lasting consequences of childhood adversity at the molecular and cellular level. Why am I introducing the term adversity? It's because in neurobiology, the studies that focus specifically on pedophilia are very rare. Usually studies focus on abuse, maltreatment, or trauma, which includes sexual trauma, emotional abuse, and also physical maltreatment. And these sometimes overlap. And a second difficulty is the fact that most studies do not differentiate between the age of below 12 or 13, which we learned that is the cutoff for pedophilia, and later adolescence. So looking for about numbers and data on pedophilia, I learned that April is Sexual Assault Awareness Month. So I don't know if it was a coincidence, a happy coincidence, or it was planned to have this talk today. And sexual assault in the United States is alarmingly high. And every minute almost, an American will be sexually assaulted and has long-lasting consequences. 50%, half of the women who are raped will develop post-traumatic stress disorders. What are the numbers for minors? 1 in 9 girls and 1 in 53 boys in the US under 18, so minors, will experience sexual abuse or assault by an adult. So, with these high numbers in mind, let's see what are the long-term effects of this trauma happening in early life on different levels, on the genetic and cellular levels, on the brain circuit level, and on the behavioral levels. And hopefully, putting together all these levels will give us some insight into the pathogenesis of post-traumatic stress disorder and other disorders that are experienced from the victims of childhood adversity much later in life and chronically. So let's start with behavior, which is actually the most easy to evaluate. And I will present a relatively recent 2019 review, which reviews actually 19 meta-analyses. So it's a meta-analysis that includes over 500 primary studies and about 4 million participants. So what were the outcomes of this study? What the authors found is that childhood sexual abuse is associated with a wide range of psychosocial, psychiatric, and physical health outcomes. In psychosocial outcomes, we have sexual dangerous behavior and also sexual I know it's not a good term, but deviation, I would say. And there is a big proportion of substance misuse, 28%, and also suicidality. In psychiatric diagnosis, you see in the red box that the odds ratio are significantly increased for eating disorders, post-traumatic stress disorder, 38%, depression, anxiety, borderline personality disorder, and conversion disorder. So post-traumatic stress disorder is the most prevalent in longitudinal studies and in large cohorts. And in the DSM-5, it is described as re-experiencing the traumatic event, avoidance of distressing memories, persistent negative cognition and mood, and alteration in reactivity, reckless disruptive behavior, and sometimes aggression. And post-traumatic stress disorder is comorbid with many other psychiatric disorders, major depression, suicidality, generalized anxiety disorder, obsessive compulsive disorder. And as Dr. Thibault said, 30% of psychiatric patients have experienced child abuse at some point in their life. There are also physical health outcomes with increased odds ratios, obesity, HIV, pain, and especially fibromyalgia. So how now these outcomes can be related to or attributed to brain circuits? I will present you again a review that looks at the brain circuit level through different kinds of imaging. This is something that has very much advanced in the recent years with a technological advancement of imaging. There are many studies. I will give you the most striking highlights that are described by the authors. So first of all, there are effects, long-lasting effects of childhood abuse in the developing brain. There are changes in the white matter and the pathways that and the gray matter, so regions and pathways that related regions between them after childhood trauma, and these can be specific to the type of trauma. For instance, these include visual and association cortices, as well as somatosensory areas in childhood as sexual abuse versus auditory areas when we have parental verbal abuse. Both are traumas, but they are very different, and these specific modifications relate to the sensory systems and pathway that convey the aversive experience to consciousness. A second factor that will influence the type of difference that we see is age. Actually, you can see that with age at exposure, different areas are differentially vulnerable. So at early age, it's hippocampal volume that will be the most vulnerable. At an intermediate age, it will be the amygdala that will be the most vulnerable. And at the later stage, it will be the prefrontal cortex. And this is because these regions maturate with different rates. So those that are more vulnerable are the ones that are developing and maturating at the age of the incident. Now, independently of the age and independently of the type of trauma, there are long-lasting consequences and network changes associated in general with childhood maltreatment. On the left, you see that you have a reduced connectivity of the cortical area, and here the left anterior cingulate, which is marked in green, In the upper panel, you have control individuals, and in the down panel, you have maltreated individuals. And so hypoconnectivity of the cortical area and hyperconnectivity of the amygdala, which regulates emotion, and here is the insula, but it's the same for the amygdala. So insula, which also regulates emotion and especially negative bias and anxiety. And at the right, the precuneus, which is also hyperconnected, and it's a region, a core region of the default network. So what we have, putting all these three together, we have a disruption of top-down control. That is, we have much less cortical and cognitive control on emotions and negative effects. So what we see at the brain circuit level can explain some of the behavioral changes that we saw before, such as substance abuse, or PTSD, or increased rumination and depression. Now, what is happening at the gene and cellular level? That is something that it's much more difficult to see in to evaluate, because we cannot look at it in a living subject. So a major study came from the Douglas Brain Bank in Canada, based on post-mortem samples. And what these investigators did is that they focused on the anterior cingulate, the region that I showed you before that shows hypoconnectivity. Okay, so they looked at post-mortem brains of 3 groups. Abused, depressed suicides, people that have died from suicide, that were depressed and have been abused as children, non-abused depressed suicide. So we have depression, but we don't have childhood maltreatment, and sudden death, no depression, as control subjects. So first, they looked at a large-scale analysis of methylation, and methylation is an epigenetic process that will determine the availability of a gene to be transcribed. So what they saw is that there were 3 genes that were differentially methylated between abused, depressed suicides and control subjects. And these genes were associated with myelin proteins, with white matter proteins, which could affect the way that the anterior cingulate can be connected to other regions. So what these results showed is that oligodendrocyte related and myelin related genes could be differentially transcribed. So next, they did a transcriptomic study of myelin and oligodendrocyte related proteins. And what they saw is that there is a differential regulation, and most proteins are down-regulated in yellow. There are some that are unchanged in gray, and some that are upregulated in red. But most of them are down-regulated, and this concerns myelin proteins, myelin synthesis and maintenance, and oligodendrocyte-related markers and factors. Okay, so how this differential transcription relates to function? What they did at the 3rd step is that they examined the integrity and the structures of myelin sheaths. And what we saw is that here, in the previous slide, it was again a comparison between abused childhood and control. Here we have also the 3rd group, that is the depressed group, to see if the changes that we see can be attributed to the fact that there is a childhood maltreatment, or simply to the fact that there is depression. And what we see is that there is no difference between the control group in blue and the depressed group in orange, but there is a very significant reduction of the axon diameter in the abused group, childhood abused group, and there is also a reduction in the overall diameter of the axon plus the myelin sheath. And when they do the G ratio comparing the axonal diameter to the total diameter, they see that the myelin sheath is very, very thinner in abused, childhood abused subjects, which could explain the reduced connectivity of the anterior cingulate that we have seen in the imaging study. So taken together, we can say that childhood sexual violence and childhood adversity in general has long-lasting and devastating effect at all the levels that can lead to mental and physical health problems. And we can also propose, based on these results, a model of vulnerability in which genes and environment interact. They will modify epigenetic and transcriptional programs. They will modify myelin structure, which will change, alter connectivity, and which ultimately will change integration of emotional, cognitive, and sensory information and can lead to pathology. So now what I presented to you is one hypothesis, okay, based on this work between myelin structure and connectivity. There have been a number of other hypotheses explaining the link between genes, environment, and pathology. And they have suggested that changes in the blood-brain barrier, hormonal changes at the hypophysis axis and the glucocorticoid receptor, as well as inflammation processes, can alter also brain plasticity and be the mediators between early trauma and adult pathology. So I started by saying that April is Sexual Assault Awareness Month. What does that mean finally? And what is the take-home message from what I presented to you is that we have to react to sexual assault, and especially sexual assault to minors, first to prevent by increasing awareness and education. And that's what very elegantly Dr. Timmery talked about. And second, for us as researchers, it's also an opportunity to talk and promote research toward treatment. And I would like to evoke two types of potential therapeutic strategies. One would be to target the neuroplasticity of the brain in order to reorganize defective brain circuits in abused subjects. And the second would be to explore molecular substrates of vulnerability to find novel pharmacological targets, knowing that there has been no new treatment for PTSD in the last 20 years. So I would like to thank my collaborators in this big program that we are having on the effects of stress at different ages and brain circuits and periphery and psychiatric disorders. And I would like to thank you for your attention.
Thank you very much, Eleni, for this very nice talk. And I have a lot of questions to ask you.
Okay.
The first one, so you spoke about abused child and childhood and abuse during childhood. Did this work, so the same work was done also on sexual predators or not?
Well, there is not much on sexual predators. Okay. I really don't know about large-scale studies on sexual predators, and I think that's what Professor Thibault also said. And also, a point I did not explain much is that a part of these neurobiology studies also relies on animal model studies, and findings are validated. Findings in human population and in patients or in victims are validated in animal models, and it would be very, very difficult to create a model of sexual perpetrator in the animal. There are models, however, of aggressors, okay, but not sexual perpetrators. And I have looked on what has been done on aggressors, and there is not much, because aggression in these studies is seen as a very baseline phenomenon. So there is nothing, and it has been related especially to regions like the habenula, but there is nothing that addresses aggression as a dynamic phenomenon.
Okay, my second question. So you talked about some areas of the brain that were hypomyelinated. Do you know if other parts of the brain will be hypermyelinated? Because in the case of hypomyelination, we could have the death of neurons. So did you notice the death of neurons in these areas? And second, is there other areas that were hypermyelinated?
Okay, it's not the death of neurons in this study. It was not the death of neurons. Actually, maybe a turnover of neurons was different, but it was not a death of neurons, because the number of neurons was relatively stable. It was mostly a change in the axonal diameter and the mile sheath diameter and other morphological changes. So there was no death of neurons. Regarding hypermyelination, in our studies, we have seen some hypermyelination, especially in posterior areas in early ages, but these are preliminary findings of our studies, is more or less reversible. There is this hypermyelination that we see at a certain time point around adolescence. So what it could be, but if you have another hypothesis, we will be glad to discuss, would be a shift in the maturation of the white matter.
Thank you very much, Eleni. There's a question from Florence.
Yes.
So we have a question.
May I
have a
ask
question on YouTube
okay.
to Professor Thibault. So the question is, are there any data that links dementia and pedophilic disorder, like what is the prevalence, which type of dementia, and what are the risk factors for this association?
The main risk factors are linked to frontotemporal dementia, and in general, sexual disorders are very much linked to temporal and frontal lesions of the brain cortex that might be after brain trauma or related to dementia. So other neurological disorders such as Huntington disease, for example, or multiple sclerosis, when there are lesions in the temporal and frontal regions, might be associated with sexual disorders. But there is also an increased risk with Parkinson's disease, but only when these patients are receiving agonists treatment. So dopaminergic agonists may also be associated to an increased risk of sexual disorders in Parkinsonian patients, as well as compulsive game, but also to deviant sexual behaviors.
Thank you.
Florence, you had a question to Eleni?
Oh, yeah, exactly. Helen, may I ask you a question? There is an interesting thing. There are some data, very few, like 5 or 6 neuroimaging studies showing that there is an indication of reduced gray matter volumes in brains of mainly pedophilic patients, and mainly those that are sex offenders. And there is also, I think, one paper showing a decreased white matter volume too. So I was just wondering, most of them are pedophilic sex offenders, but I am not sure that they have studied the past history of child sexual abuse, and if that was taken into consideration as a very important bias, because you think that you may think that is mainly related to past history of sexual abuse and not to pedophilia or pedophilic disorder by itself. So what do you think about that?
I think that your remark is fantastic and very, very much to the point, because as you said, and as the review I commented also said, abused individuals can become abusers in one hand, so that has to be controlled. And if this is the case, it might be more related to the past abuse, because what I didn't say is that these reductions, I don't know about which regions we are talking specifically, but hippocampal gray matter reductions and hypomyelination and corpus callosum decreased density,
Exactly the same regions, yeah,
are seen in abused patients that do not have psychiatric disorder, because there are some that are resilient. Okay, so this is an endophenotype of the fact that they have been abused and not of the current symptomatology. So this is a long-lasting signature in a simplistic manner of the brain structural changes of past abuse, independently of the state situation of the individual, resilient, depressed, PTSD, or whatever, or offender.
Yeah, and I have also another question. Something might be of great interest for us is to try to identify among those with past history of child sexual abuse, those who will become perpetrators of sexual offenses, because this is a very, very important question to try to prevent this the thing that they will become perpetrators at one time in their life, and we don't know who and we don't know why.
Yes, I think that's the big problem in psychiatry in general. If we could have predictive indicators, that would be great. There have been studies with in animal models with aggressors that we try to find whether animals that have been maltreated will become more aggressive when exposed to a second stress. And that's the double hit hypothesis, which says that there is something that happens early in age, and it will shape all those circuits, but it will also shape the way that you will respond to a second or multiple stressors later in the life. Okay, The problem is that, as I said, it's very, very difficult to devise a model specifically for sexual aggression in the animal. But that's something that we could discuss and brainstorm about altogether.
And if I may, I have a last question concerning your very interesting neuroimaging studies. Is there any gender effect might be also of interest for us? For example, we can imagine that these changes might be more frequent in men and not in women, and which may indicate that some of these changes were more frequent in men might be related to the fact that they can become perpetrators and not females.
Okay, that's very interesting because actually the changes are different at the structural level. They are a little bit more pronounced in males concerning the cortical areas. The reduction is more pronounced in males, but in females, you have the that's not published yet, but in females, you have the subcortical areas that are, and the anxiety-related areas that are insulted more. And behaviorally, what we see in animal models is that the behavior is not the same. The females are very, very anxious and very inhibited, while the males are practically disinhibited and sometimes more aggressive. And that's something that when we discussed with Marie-Lo Payer and Jean-Luc Martineau and David Cohen, who were brainstorming with us on this study, is something that you can see also in adolescents, victims or patients. So it might pertain to this inhibition, and this hypervigilance may explain the difference in the likelihood to become offender in males or females. On the other hand, I mean, we are talking from a very biological perspective, but there is also the cultural and social perspective to put also in place.
So thank you very much. Really, I enjoyed with Pamela this multidisciplinary meeting. So we had several points of view on pedophilia, from literature to medicine to science. And to close this meeting, I will introduce Dr. Eli Haddad. Dr. Eli Haddad is the president of the Euro-Lebanese Medical Society. And I leave the floor, Eli.
Oui, permettez-moi de dire un petit mot juste en français, vous allez bien parler en anglais. Au Liban, on tient bien à la francophonie aussi au français. Juste pour vous dire que cette société Euro-Lebanese Medical Society, c'est une jeune société. On n'a même pas un an encore, on aura un an le 27 juin. On a fait beaucoup de choses, mais principalement, c'est une action scientifique qu'on voulait faire dès le début. Et là, on commence avec vous, officiellement, cette action scientifique. Je voulais vraiment vous remercier tous de votre implication, de votre excellent travail. D'abord, Madame le docteur Joumana Timeri Chahal, je suis très fier que vous soyez là avec la présentation que vous avez faite. Professeur Thibault, c'était excellent aussi, très beau. Docteur Eleni Zavanin aussi, merci de votre intervention. Je veux remercier surtout mon ami le professeur Massaad pour son implication. C'était lui qui avait eu l'idée de ce sujet-là. On est tous tout de suite été emballés avec cette idée-là. Avec Dr Pamela Hwes aussi, merci pour ta présentation. Merci au Dr Saadallah Tamer, notre webmaster caché. Il est chirurgien cardiaque, mais il est aussi webmaster avec nous. Merci à tous les membres aussi du comité scientifique, je vais les citer là, Dr Samia Abou Jaoudé, Dr Hassan Al-Hajj, Dr Riba Al-Maraï et Dr Tatiana Al-Hajj. Et encore un grand merci, enfin, au Dr Elsa Mhanna, qui est le moteur de cette action-là. Juste un petit remerciement pour vous tous. Attendez-nous régulièrement dans des réunions scientifiques de très haut niveau comme celle-là. À la prochaine et bonne soirée.
Au revoir.
Au revoir, merci.
Bonne soirée.